When she first showed up in the ER, it was clear that she had broken both her legs, had an unstable pelvis, meaning that clearly she had fractured that as well. They had already placed a breathing tube to sort of, assist with her breathing and everything. And on our initial evaluation, we realized that she had sort of collapsed her left lung. She was taken to the operating rooms pretty quickly, mainly just to sort of decompress her head to make sure that if her brain was going to swell, it would have room to accommodate that and not pinch off the blood supply. Say it had like 20 fractures. It was an open wound, meaning that the bone had torn in the skin, so he was at high risk for infection. He ended up getting over 10 units of blood that evening alone, just to sort of stabilize, to make sure that the other organs in the system were continuing to receive the things they needed, the oxygen, the glucose, the sort of nutrients they needed to survive. He's taken this in stride. He's sort of seen it as, definitely a day that changed his life, but he hasn't let it stop him from going on with life. She was a pretty sick little girl, had some pretty bad lung disease, something called bronchopulmonary dysplasia, and as a result of that developed pulmonary hypertension, which is simply hypertension in the blood vessels of your lungs. And it required her to be placed on a ventilator to assist with her breathing, but it also required us to start her on a continuous medicine to help control the high blood pressure in her lungs. Jasmine's a fighter, and we believed in her, and the staff believed in her, and Jasmine has proven over and over again that she's a tough little kid. I wouldn't try to pull anything over on her.
I'm not going.
Can you throw it?
It can be fatal. You can die from this. You basically lose enough of your skin or of the mucous membranes where it's almost like a burn. I think he has the same risk for having it develop as he did the first time. So, but no, it's not a one time and you're done sort of diagnosis. He's obviously going to avoid exposure to the antibiotic that he got, but unfortunately, no, he could experience it again.